I'll just get Michael to change over the slides. We'll move right along. It's not afternoon tea yet. Just packing you full of food and coffee, aren't we? What's going on? Health and disease. In the camel milk industry, it's important for us to be putting health of the animal first. And to this end, we've invited Dr. Margaret Bale to provide a synthesis of the tools in her experience that they've found practical in terms of farm veterinary assessments, disease risk management and herd health strategies for the modern Australian dairy. Dr. Margaret Bale is the Chief Veterinary Officer for the Australian Wild Camel Corporation in Queensland. Dr. Bale has been working as a clinician for 23 years. For the past 15, Margaret has been predominantly dairy cattle at the University of Queensland, and that include all aspects of herd health, reproduction and surgery of production animals, and she also is lecturing in camelid medicine. In this clinic she also saw a large number of camelids, and in particular dromedary patients, and this soon became her special focus. 2 years ago she was approached by the Australian Wild Camel Corporation to work as Chief Veterinary Officer to help establish a large-scale commercial dairy farm. She's committed to assisting all camel producers, however, and in the industry in Australia. Dr. Bale's talk today is entitled Healthy Animal, the Beating Heart of the Industry. I'd like to welcome Dr. Bale.
Thank you. Yes, that one should work now. Thank you, and thank you for inviting me here. It's quite intimidating having to speak after such illustrious speakers that we've had already. But hopefully I'll be able to give you a really practical, hands-on approach to problems that we have, veterinary health, otherwise, with all our camel dairies, whether we're just emerging or a little bit more established. Just a little bit about me, which has already been covered by Mark. Now I'm working exclusively with camels, but my background mainly is in the cattle dairy industry, all aspects of surgery and herd health, and also the milk quality. So I honestly believe that camels are the ultimate production animal and are currently the most underutilised resource in Australia, and I'm pretty sure all other cameliers out there will agree with me. The industry is where the cattle industry was, I would say, 100 years ago in terms of the scientific data processing, the infrastructure, the regulation and the genetics. It's our responsibility to give it good foundations now to legitimise the industry and take it forward. Not just meat, not just milk, the industry as a whole. No camel, no growth. Basic herd health protocols and practical information for producers and veterinarians out there to control your entire herd. Australia is in a unique position, not only in the world, but in the fact that it's such a large country. We've got so many different areas in which our camels are being held. From areas in Victoria that has its own set of geographical problems. We've also got a camel industry up in Queensland, again with geography, with weather problems, the fact that we're on the east coast with higher rainfall. Every area, every specific state and every region within that state has its own set of problems. And that's why you need to be in charge of your herd on your farm, in your area. This is a little bit of the geography of the industry in terms of the map of the camel distribution in Australia. As you can see with my new pointer, which I've stolen from Rafat, I believe, most of the camels are in this region. Mark obviously is the expert on the distribution of the feral camels in Australia. It's interesting though, this is where most of our camels are being supplied from at the moment, whereas most of our camel industry is on the coast. So therefore, again, that highlights the fact that transport, the cost of transport and the act of transport, the type of transport is really important. Also, you've got a whole lot of different disease, state protocols to have to navigate to get this industry to move forward if we're just going to utilise the feral animal population. So as yet, regulated and sophisticated breeding program is yet to come to us in Australia. Ultimately, it should be our aim, as it was in the cattle industry, to map the camel genome of the Australian camel production systems and start a selective breeding program, which Lulu talked about, within our own herd and ultimately across all herds. We're increasingly fortunate to have some of the best speakers here today coming to this forum, so we should all take this and take it as a leap forward and work together and see what we can do in the future. I have said we've got a holistic approach to animal health. Whenever I heard the word holistic, oh God, she's going to talk about herbs and that sort of stuff. It's not it. Holistic means the whole animal. We're very fortunate. I think tomorrow we're having a lot of behavioural talks on stress of camels and how to manage your herd. Health of camels starts with behaviour, and the entire camel practice on farm, from the collection of the feral camels to the milking and the placement of these feral camels into an intensively managed system. Again, Lauren will be touching on this tomorrow. Stress causes a huge physiological response in the animal. Anyone here, everyone who's worked with camels realise that when they're stressed, you can't win. No one wins, the camel wins, but even then it doesn't win because it's stressed. So what our job is to identify the areas of stress. One of the areas that I've come across, and again, there's more behaviouralists that will be able to chat on this, obviously overcrowding, but one of the others is exercise. I'm finding that they really do need to exercise. I did remember speaking to Peter Nagy. He recommends about an hour and a half a day just on exercise to maintain that health of that animal, the holistic approach. You've got other things like malnourishment, disease, but the big one for me, freedom from diseases we can control, and then later on in the talk I'll talk about things that we can't control. On our particular property we use low stress stock handling techniques. We can talk a little bit about that further, not in this talk. Again, the stress is the one of the biggest things that we have to overcome. Great movie, great slide. This is where I come in as the veterinarian, and I'm lucky enough to be with some other camel veterinarians around here today, and I think you can all agree, and even those that aren't working as the vets, help me help you means I cannot fix your animal if I cannot get to your animal, and I mean get to the whole animal. I'm sure all of us have been in the situation, all the vets here nodding their heads. You get called out to an animal, you can do so much, but if you just can't catch it, get near it, touch it, that's really important. From over 20 years of large animal practice, I cannot treat your animal if I cannot touch it. Having an area on farm dedicated to animal investigation, treatment and management, I think is vital. The dairy industry, no matter how you look at it, is an intensive industry. The animals do come in twice a day for milking, but I firmly believe that the milking parlour is not where we should be treating, assessing and performing our examinations on these animals. Yes, you can train to hoosh, however this is not suitable for a thorough veterinary examination. You can't see their udder, you can't see their milk vein, you can't see their lower limbs. There's a lot more to the camel than just what's happening right at the front and what's happening right at the back. The hoosh position, whilst it's fantastic for training and management, in terms of a veterinary position, it's not appropriate. We need to access all of the areas of the animals safely. Also, think about having a set of scales in a restraint system. All animals, I believe, need access to a set of scales. You can guesstimate, and there are those, girth tapes and that sort of stuff, but some of the most common problems are just because the animals haven't been dosed accordingly. Again, help me, help you. So we've actually up on farm, just from, being kicked, squished, spat on, trodden on too many times than I care to remember, I kind of asked nicely, demanded that we make a designated area for animal handling and management with a crush. We'll talk about this again probably in an informal setting about how we've designed it. This is a modified cattle crush. Obviously I'm a little short, I do have a little ladder. So this crush is shorter, narrower, we've got a squeeze that squeezes the entire animal. This one, I haven't got a good photo of the head restraint particularly there, but you can actually just pop a halter on that animal now and tie it around to the side. As you can see, I get fabulous access to the jugular vein for very basic blood collection techniques. In this particular crush, we can also, this is a young, poor animal, but this particular crush, you can see the excellent level of restraint that we've got here. Again, modified, I can actually open up, all the, over-accessorising here. I can actually open up the sides, I can get to the lower limb, I can get up here, I've got the animal fully restrained there. In this particular one, I've got what I call a belly strap, but it actually goes under their shoulders here. And I've also got another one, again in a modified technique, because we're always learning. I'm always trying a better way for animal restraint. I also would suggest an actual groin strap. Talking to a few people out there, I've got some hot tips on what to make that strap out of. But also here you can see how easy it is for me to not get kicked and treat this animal's lower leg injury. So these animals that are coming to us, you know, completely degloved on that lower limb, I can actually easily get to, it's not dirty, they're not cushed, and that animal was not sedated. So that's one other very good thing. Ruminants and sedation, we all know, you've got to be pretty specific and know your stuff. So it's much easier if we can do all these procedures standing up. Here's me doing a standing castration, incredibly easy in terms of restraint of the animal. Again, this animal, well, is anyone from PETA here? Sorry. This was not sedated, but because of the squeeze, I honestly find because of the squeeze crush that squeezes down the whole side of the animal, and it's a quick release, so it's very safe, because of that squeeze, they feel comfortable, they're not moving around, and you can actually get in and do a lot of normal veterinary procedures that you would expect to do in cattle dairy practice. Next one, we're talking about general health maintenance protocols. So again, this is the exciting thing about the industry, is that we get to now tailor best practice from the word go. So if we can all get this under wraps, we can get best practice right from the beginning of when we're starting herd management. In our dairy herd, we've got our cows, but also increasingly we're going to be having our bulls, certainly now with artificial breeding techniques. In our dairy herd, we use a 7-in-1 vaccine. The reason for that is for, in Australia, leptospirosis. It's more, again, in line with the Dairy Australia protocols, because again, we're trying to start the industry on best practice. You can use a 5-in-1, it's a little bit cheaper, but it won't cover for lepto. And lepto is a disease, a zoonotic disease, that we, as camel dairy people, are going to be exposed to. There's this really interesting one, the rotavirus coronavirus. Again, it depends on how many calves you've got, what your calf housing is like, and your management. This is an interesting one I can talk to you about later. I'm not sponsored by any companies, I wish I was, but I like the idea of this. This is a vaccine protocol that you can do 2 injections 4 to 6 weeks apart. This vaccine will cover E. coli, rotavirus and coronavirus. So this is mainly for our calves. So who are we injecting? We're injecting the mums before they give birth. So that's going to drop our level of calf disease before the calf's even born. So I think that's a really good one. Cost-wise, you've got to work out how much it's going to cost, and if you can factor that in. Also, again, a lot of those diseases can be helped with husbandry, but again, E. coli can also contribute to mastitis. You don't want that. If we can vaccinate against it, so these cows are dropping and not even being exposed, then you start that lactation with a good clean slate. Tick fever is another one. You can't really, it's around, they can get it, but the tick fever vaccine I wouldn't recommend to use at all. You'll get a huge reaction, and I wouldn't do that. You're better off using your ectoparasite control for that, I believe. Corynebacterium or cheesy gland. This one I'm sure you've all been exposed to as a vet. They're incredible fun. Like, there is nothing more satisfying than lancing one of these abscesses, but they are also highly infectious. Cheesy gland, again, you can do what's called an autologous vaccine. So basically you make your own vaccine from your animal with that particular strain. Sounds like a lot of hard work. is cheesy gland really affecting your production at the moment? That's what you have to go into in your area. Remembering we're getting feral camels. These animals, pretty much, well, I don't know, most of them, it'd be interesting to see what everyone's doing, seeing from around here. A lot of them have these big purulent abscesses, and unfortunately, there is no vaccine made specifically for camels. Now on to my bulls. So the bulls, again, they're not being milked in a dairy situation. You can get away with a 5-in-1 injection, okay? So saving a little bit of cost there. I personally, being a vet, I'm pro-vaccination, so I think leaving nature for clostridial diseases, which is in these 5-in-1 vaccines, to go on, you'll wipe everybody out. Campylobacter or Vibrio vaccine, we're doing that as standard now. You'll find certainly with the emergence of embryo techniques and AI techniques, and also with natural mating, Campylobacter is something that has been isolated from the use of infected camels in the Emirates. And I think, given now the industry hopefully will be a little bit more proactive in terms of, you know, natural mating and trying these assisted reproduction techniques, I really think Vibrio is a vaccine to think about moving forward. Now, the big one, worming, although maybe not so big for some of the areas in Australia. For those international guys, Australia is gigantic, and what is a problem for a Queensland dairy farmer is not a problem sometimes for a Western Australian dairy farmer, although I'm pretty confident that we're low in selenium all over Australia. But talking about worms, one thing that we're using on our particular farm with great success is physical control. That is literally physical removal of the faeces from whatever pen that they are in. That is actually one of the best ways that we can do this. This will help prevent worm anthelmintic resistance in the future as well. Targeted worming protocols, what does that even mean? It means targeted to your individual property. Well, how do I know what worms I've got? That's when you've got to start calling the vet in or start being proactive on farm, and I'll go into that in a minute. There are a couple of other options, no one size fits all. Don't think that you can, there's just one magic treatment. You've got to target them and target it specifically. Again, we're at the start of an industry. If we start with best practice, it can only get better, rather than have what's happened in the sheep industry where there's ectin resistance all over the place. And you're basically getting rid of a whole group of drugs just because it's been used improperly. One thing I'll say while I'm on this, because I've just remembered, one of the biggest reasons I have found in literally 20 years is people not dosing the animal correctly to the right weight. I've had alpaca dairies completely, alpaca farms completely decimated just because she didn't get the right body weight for years and years and years, complete resistance. Get a set of scales in your restraint area, or get a set of scales that the animals can easily walk up onto. You won't regret it. You can then use that for all your data collection. Weight gain. Is she putting on weight in the pregnancy? When we're doing this feed trial, are they putting on weight? Are they losing weight? All that data we need to collect, and that's on us. That's on us to collect, no one else. A couple of other things. Charcoal is also a really good additive. DE is one called diatomaceous earth. We've seen that anecdotally up on the farm to perhaps have some effect. Again, there's no studies on all of this. If anyone wants to, that'd be great. Or I'll do it if someone will look after my children for me. Basically, I want to say faeces is your friend, and I mean this. You can learn so much just from doing fecal egg counts on farm. What does that mean? That means you get a sample of the faeces, and it gives you an idea, it gives you a little window, a glance into what's happening on your farm, what worms are prolific, are there any one that's more prolific, which animals are shedders. It's the fuzz. What I mean by which animals are shedders, it's been known and hugely developed in the equine industry to identify animals that shed worms more than others. You don't want them in your herd. It means that even with a low burden of worms, those animals are going to produce more eggs and produce more adult worms, and that'll just keep it all happening in your herd. You want to identify those shedders. How do you do it? This is a really good link. it'll be in notes, I'm assuming, unless you want to memorise that. That's actually a step-by-step guide on how we do our fecal egg counts. We do them on farm. This is literally all you need. I'm sorry that's a bit blurry. You literally need a microscope and very, very basic equipment. A spoon and a tea-sieve and fecal float solution, which if you want to be a little bit tight, you can make yourself just with a super saturated salt solution. I like buying the fancy stuff, sorry. So basically, this is great, isn't it? Thankfully, we've had lunch, but fecal float collection 1. 2 grams of faeces, that's it, 2 grams of faeces, fresh. Now I say faeces, not, I told my friends I wouldn't swear, not, poo is on the ground, S-H-I-T is on the ground, faeces is from the animal. Okay, you can't just go around picking up poo from the ground and thinking I'll do a fecal egg sample. It has to come straight from the animal. If that faeces sample has been on the ground in that time, and it only takes a few hours, within that time some of those eggs will hatch out and you won't get an accurate fecal egg count. So fresh faeces, literally pouring in an amount of water, all these amounts are on that link, it's a really good one, of fecal float solution, macerate it up a little bit, pouring it through a sieve to get rid of the particulate matter. The idea of the fecal float solution is it's super saturated, eggs are very light, they float to the top. And then you're taking off the top of the solution, putting it into one of these. I would highly recommend you get one of these. They're called a McMaster egg slide. I find them super easy to use, and I also train all our staff to use these. Paul's got a particular penchant for it. He's very, very good. What it is you fill each chamber, and each one of these chambers, you'll see in a moment, has got very distinct graduated lines etched into the slide itself. You're filling the chamber. You are then literally counting the eggs in each section. So there's one sort of small corner of an area of that graduated slide, and here you've got 2 worm eggs. 1, 2. Count up how many is in each section, write it down, multiply it by a multiplier in the formula that they give you, and that will give you a fecal egg count for that animal. What does that mean? Then you can work out, is it 600? Is it 20? Okay, is it 20? Is it 600? Is it 22,000? On that number, that will tell you when to worm. Every vet will have their cut-off number in that particular area, also for the age of the animal, the type of worm egg. This is what you'll see on an egg comparison. I don't expect you to commit this to memory, and some aren't as important as others. So we don't have liver fluke up in where we are in Queensland, but the Victorian guys do, is that correct? So that's a fasciola egg there, so you've got to see that. Again, all of this information I'm more than happy to give to you as well. Trichuris is a big one, everyone would have heard of that, that's your whipworm. Differentiated egg, you see that, you know you've got Trichuris. These ones here, Menesia. I find that in a healthy adult animal, I'll see a few of these and I'm not too concerned. That's a tapeworm egg, but I did see that slide. Was it Rafat's slide? That was a fairly epic, I think we could agree, tapeworm infestation. And then the most common ones are the strongyles, and the nematodes there. So with those two, you add that up, you get a level, and then you can work out your fecal egg count. How does that relate to the drug that you're going to choose? It's all about, have you already got resistance? Is there already resistance, or are you cultivating it? So what you do is what's called a fecal egg count reduction test. So you've got your first fecal egg count. That day, you decide you go fecal egg count, okay, oh my gosh, that's 1,200. Got 1,200 eggs per gram, now it's time to worm. I know what type of worms they are. I'm going to use this particular anthelmintic. How am I going to know if it's working? I'll take a sample, that's how I know I've got 1,200. Then I'll just say Ivomec, okay? How do I know if that's working? In 10 days after that initial treatment, take another fecal egg count. If you've got a reduction less than 95% in number, you've got resistance. And that's when you know you've got a problem, and you've either got to go back and change anthelmintic, go back, make sure you're weighing your animal correctly, and then it's a self-check mechanism just by doing your own on-farm fecal egg counts. It's a really good way. If you don't want to do it and you don't want to set it up, sort it out with your local vet to get some sort of deal that you can do cheap fecal egg counts. You drop in 5 or 6 a week, get a deal and get them to do it. You need the data to be able to move forward. Just touching on other preventable diseases, there are so many, and I mean, animal health in 45 minutes is a tough gig. Coccidiosis is a stress disease. I think we can all agree with that. As I said, stress and behaviour and training is going to be covered in another section. I won't even go on to there. It is treatable, however, it does mean that there is something underlying. At the end as well, I've over on the table where the other samples are, I've actually got, it's very basic, a set of tables. Thank you. Tables, very easy. It's got injectables, pour-ons, orals. It says what medication it is, and then I've ticked what worms it covers. Endoparasites, ectoparasites. I've also got on there for you milk withhold times. Super important. Everyone on the farm needs to know about milk withhold times as well, and diseases. This is another big one. And I call it preventable because they are preventable diseases. Toxic plants. Again, each area in Australia will have its own region for toxic plants. Talk to your vet. Talk to other cow dairies in the area. Talk to other meat producers in the area. Find out what toxic plant in your area is of particular importance. Where we are, we've got lantana and bracken as an issue. It doesn't matter where you are, mouldy hay can be an issue. Solanum's proven to be an issue before. All of these are actually easy to diagnose if you take samples. Sometimes, yes, some of these diseases cause sudden death. Well, what sample do I take then? Heaps. If you have a dead camel in front of you, which happens, let's be honest, you need to call the vet and make sure that the vet will come out and knows which samples to take and stores them appropriately and sends them to the appropriate laboratory. Again, it would be lovely if we could have, we do have diagnostic testing through the DPI. It does often take a very long time to get the results back, but it is something that should be utilised in terms of data collection, I firmly believe. Please don't give up and just think, oh, it's a dead animal, it could be this, it could be that, it could be this. Please use it as an opportunity to collect information. Make your vets accountable. If they don't know what it is and they go, oh God, the camel lady's ringing again, get that vet to call one of us that are comfortable and happy to talk about camels. There is no need for these to be put in under the basket of, oh, that's all too hard. I use exactly the same principles of disease diagnosis and control in camels as I do for any other animal species. You just modify it according to the specifics of that particular animal. Other preventables easily touched on and very well covered by Rafat, grain overload and lactic acidosis. A little hot tip I said today was about being practical. One thing I have found is, how do you tell? I can get a rumen sample through ruminocentesis. I'm just clearly gifted in that area, I think. But no, it is something that you can do, but you do need the animal restrained, you need it in the right area, you need it to be done by a veterinarian. But there are other ways that you can tell rumen acidosis and lactic acidosis. One of the things that I've found through happenstance, these little sticks you can actually just get from the chemist, and they are ketone sticks. They're for ketones and glucose. They're for the urine, but guess what? They measure acetoacetic acid. That's also in the milk. So if you are desperate and she's dropping milk and she's losing a bit of milk yield and you don't really know, but you've changed the food, you can't quite get the vet out, do a little test yourself. Has she got ketones in the milk? Has she got acetic acid in the milk? Yes? Cool. I can ring the vet and say, right, I think we've got a grain situation. Just a little tip. Nutritional deficiencies, again, huge. I think Australia is definitely selenium deficient, so that's another issue. But this is a big one too. Vitamin B1 will cause this horrifically long name called polioencephalomalacia, wobbly camels, weak necks, camels not performing to where they should be. It can present in so many different ways. B1 is normally produced, help me out here, by bacteria in the rumen. And any upset to the rumen flora, pH, activity of the rumen stasis is going to affect the production of those B1 bacteria. If you don't have B1, you will get these diseases. How do I treat it? Injections. I think that's the easiest way to do it in that particular area. Another area of nutritional deficiency that I'm finding quite remarkably in males and females is calcium. So traditionally we use calcium, she's low in calcium, whether or not it's around calving or not, or lactation. And traditionally we use the IV calcium, so the calcigol into the neck. Be careful with that, it makes you feel really good, what it does, it gives you a massive spike in calcium. The body actually thinks, oh God, I've got too much calcium, and then shuts down calcium absorption. So by giving calcium IV rapidly, you actually turn off the way that the body absorbs calcium. It is easy to do, however. Here's my delightful 9-year-old son giving a bag of calcium IV. And I just wanted to show you, it is easy, but it doesn't mean it's right. So you're much better off using oral calcium supplementation. And this has been proven in cattle dairy practice all the time. Again, I wish I could get these brands consistently. Every time I ring my supplier, they're like, oh no, we're out of that stock, we're out of that stock. So I'm trying to go and see if I can order it from America or somewhere like that, because consistently in Australia we just don't have oral calcium stocks, and the vets are all nodding their heads that IV stuff's easy, it's just not the best. This is a nice slow release of calcium. Good Lord, this is an accident. No, this is, I was just talking to Lauren about this before. Who's tried to stomach tube a camel? Yeah, it's a slobbery, difficult, dangerous situation. With this particular stomach tuber, again, I'm not endorsed by anybody, but this one's called a whiplash. I'll show you how this is used in a few later slides. Effectively, this long part here, that's the blunt end that goes into the esophagus and down into the rumen. It's very long, so it's long enough to actually get into the forestomach. It's flexible stainless steel. It then hooks onto this area up here, then hooks onto the nose of the animal, connected to my flexible tube, to the pump, to whatever it is that I want to pump into the animal. I can actually, and the boys have seen this, I can stomach tube a recumbent animal, not restrained, myself with this. And I don't have heaps of other help, you know, you don't have a lot of other help. So this is something to look for, whether it's vets or producers. It's quite fortuitous, and I didn't know that Rafat was going to talk about selenium deficiency so extensively. Just a note that anyone that was in overseas last year, we had a lecture from Jane Vaughan, who's an alpaca veterinarian down south. Try not to use the selenium injection. It's very handy, and we've all been using it, but it has been linked to acute liver failure in camelids. The selenite, sodium selenite, is the injectable in that. I haven't seen it, I've had no problems with it, but it has been documented. So if you can, again, I haven't seen, I know yours would be a bioavailable form of selenium, but the injectable selenite has caused documented problems in camelids before. Again, I didn't know of this, the selenium product, but this is another good one, not just selenium. Think about cattle boluses. Okay, I know camel rumen is different from cows. It doesn't have that huge liquid component, but we have found, and there's been some documents from the Emirates that say that these boluses are still intact after post-mortem. They find these boluses in the animals, so they are a good option. Again, check that they're copper levels, because you can get copper toxicosis as well. I'm just thinking, think outside the box. Think of something that's easy for camels. Injections are a pain. A nice little bolus, they're actually really easy to give. Really easy to give, the boluses. Zoonotic diseases I will touch on. Melioidosis is endemic in a lot of areas up in North Queensland and Northern Territory. don't get it, basically, think about quarantining an area on your farm. Any animal that comes from the wild to our particular farm, we have a quarantine period of about 10 days to 2 weeks. In that time, if they present with disease, then they're isolated on that particular area of the farm, because we don't know what we're getting from out there a lot of the time. We don't know the source of the camels. Q fever is one that we can vaccinate ourselves against. I highly recommend that. Also lepto, no human vaccine available. I have accidentally vaccinated myself against lepto probably 450 times in my life, so I think I'm covered. But you're better off injecting your animals and covering that. Good Lord, there's so many things. Skin disease. One thing I will say about skin disease, they all pretty much look the same. Mange looks like ringworm, which looks like insect hypersensitivity, which can look like another allergy, which can look like a food allergy. It can be a food contact allergy. So many different things. Just with mange, on that, again, a quarantine for new camels, quarantine them, have them in a large paddock so they're not all touching each other. It's stressful having that transport. It's stressful being in a different mob of camels you don't know. So just have some good stocking rates in your quarantine area. Don't pack them in too tightly. Again, skin disease, sometimes it's taken me 7 or 8 biopsies, certainly 15 skin scrapes before you can actually see a mite. Oftentimes we just treat assuming that it's a mange or a mite rather than being able to find it, and I think that's actually just fine, because you can't keep going back and biopsying and biopsying and biopsying in an intensive system. She's still going on skin disease. There is so many. Ringworm, again, it's transferable. I find iodine sprays. Everybody here will have their own mechanism of control. Talk amongst yourselves, work out what's a really good way to do it. Insect hypersensitivity is very overlooked. I think a lot of people think that it's mange when it's actually insect hypersensitivity. So remember, think about that. Things to think about and ask your vet about. Johne's disease. There's entire conferences put on Johne's disease. This is something that we are going to have to be careful with the movement of camels across states. There's no legislation, I don't believe, for Johne's in camels, but there's huge programs for alpacas, huge programs for cattle. So it's going to come. We've got to know and be aware of it. So quick break, just to, child is being eaten by a camel, do you save your child or take a photo? Photo before first aid, all the time. No matter what you are, you've got to take a photo first. Wow, just on mastitis for a couple of minutes. Mastitis is persistent inflammatory reaction of the udder tissue. This is huge. Mastitis in the camel industry is going to be as important as it is in the cow dairy industry. Utilise the Dairy Australia website to get tips. Utilise a dairy vet. We've got lots of tricks and things on farm that we can teach you. Utilise somatic cell counts. Off topic, we can talk about this later on, just with some work Peter Nagy's done recently with automatic somatic cell counters. Some of them are not accurate because of the way the camel's mammary gland works. This is fascinating. Well, I think it is. Okay, so you've got different types of production of gland. Merocrine is how the cow produces milk. Apocrine is how the camel produces milk. And this is probably one of the reasons why camel milk is